Commissioner, Department of Public Safety. Doug Racine, Secretary of the Agency of Human Services.
Dave Iacovone, Commissioner, Department for Children and Families.
Dixie Henry, Deputy Secretary for the Agency of Human Services.
Cindy Welk, the Deputy Commissioner for the Department for Children and Families.
And Jeff Spaulding, Secretary of Administration.
Chris Groden, Vermont State Police. Keep me safe from people like you. Thank you so much for joining us today. And I've called together this team to make a few recommendations on steps that we can take to help us more successfully to protect Vermont's most vulnerable children. And as you know, it breaks my heart. I know it breaks the heart of all Vermonters when we lose a vulnerable child to someone who is so empty-hearted that they would take that child's life. In both the cases of Desiree and Peyton, we as a state have failed. And as governor, as you can imagine, these are the circumstances that not only break your heart, but give you sleepless nights. I've asked my team, in light of the two tragedies that we've seen over the last several months, if there are things that we could do separate from these cases, and I want to be very clear that today I am not talking about Desiree's case, I'm not talking about Peyton's case, because we know that there are numerous, both independent as well as internal investigations going on, as well as Vermont State Police on those cases, and I won't be commenting on them for obvious reasons, because as governor I don't want to impede justice that must be served to bring those who ended their lives to justice. But let's talk a little bit about our most vulnerable children and if there are things that we could do to do even better. First of all, we must remember that we're living in difficult times and that those times have become more difficult. I think it's fair to say that addiction, and opiate addiction in particular, has brought a level of threat to the children of people who are addicted that is different than the kind of threat that we faced most often when I was a kid growing up in Vermont. That under the influence of opiates, people will do things to their children that are unimaginably horrid. And the result has been, as addiction rises and as the circumstances for the difficulties these families face have risen, we have seen a doubling in a number of reports requested of abuse to Vermont's children at the Department of Family Services in the last 5 years, doubled. At the same time, we have not seen a significant increase in staffing. So the question for all of us, and what I've asked my team here today, is to tell me what as governor I can do now to give us a better fighting chance in protecting Vermont's most vulnerable kids when they're in circumstances that threaten their safety and threaten their lives. The following 4 suggestions have been made, and I intend to deploy them. The first is, I've asked Secretary Racine to get back to me by August 1st with a report concerning how DCF itself is organized and whether, because of changes that were made exactly 10 years ago, it gives us the focus on protecting Vermont's most vulnerable kids that we need, the intensity that we need for that job as it becomes more and more difficult in light of rising addiction. In short, I'll remind you that 10 years ago, in 2004, we absorbed 2 departments. Social Services and PATH, Prevention Assistance, Transition, and Health Services, were brought into the agency. I've asked Secretary Racine to look carefully at that structure and consider a Department of Family and Department of DCF that would be focused on the simple job of protecting our most vulnerable. Second, staffing. There is no doubt, and it should surprise no Vermonters, that the staff pressures are rising at the same time that we've actually seen over the years since the Great Recession a decrease in staffing. When I came in 3.5 years ago, we started to change that trend, recognizing that the caseload for each caseworker was rising beyond what are national standards that we would hope to achieve. So we increased staffing, and we moved the ratio from roughly 20-to-1 in 2011 down to 17-to-1 caseworkers per case now. Remember that since 2008, the number of child abuse investigations has doubled. So I have asked the Secretary and the Commissioner to take the provision that was allowed in this year's legislative actions of a pilot program starting July 1st that allows this agency to manage the resources within the agency to move positions around as they see fit, like a company does, to meet the pressing demands, the most pressing demands that they're facing. And in doing that, to increase our caseworkers, the folks out in the field who have the job of protecting our most vulnerable kids. The Secretary has indicated that starting July 1st, we can transition into higher staff, reducing our ratio of staff to client. We're hopeful that this particular move will result in 18 on-the-ground social workers, 6 substance abuse screeners, as well as augmenting our current central office staff to support these efforts. So first, looking at DCF itself with the idea of critically looking at the changes we made 10 years ago to ask whether they're wise, getting a report on August 1st. Second, increasing staffing so that our kids have more attention to each case, most vulnerable families. The third thing I've asked us to look at and change is training. Clearly, as we face a rising tide of opiate addiction and other challenges, training needs to change with the changing demands and risks that are being presented to our most vulnerable kids. So we have asked DCF to work with the stakeholders across the state who protect our most vulnerable kids to identify and develop further training for those in law enforcement, the legal community, medical providers, those who have contact with kids that are sometimes abused in our hospitals and doctors' offices across the state, the judiciary, and all others who play a role in the decisions that affect our most vulnerable kids. And finally, I've asked us to look at the policies that we currently employ when reuniting kids with their families after there's been a history of DCF interaction. What does that mean? There are 2 policies that I would like to change. The first is, when you have a child who's living in custody, when you have a young child in custody that's living with a parent in a residential or other supportive setting, Lund Center being an example, to ensure that a trial reunification period will not begin until after the parent is discharged from that residential setting. In other words, give the caseworker the ability to see the family in action in its new setting, not in the setting where they're frankly being supervised, both child and parent. Second, requiring the DCF central office to review all cases in which a child has experienced serious physical abuse and reunification with a parent is being contemplated. Plain English, currently a social worker can make that recommendation of reunification without a supervisor at central office necessarily reviewing the case. I am now saying as governor, that is not wise. Let's go forward to increase our odds of success in very vulnerable, difficult situations, of simply saying, once the recommendation has been made for reunification, a supervisor at central office must also review that case before the decision's made. Those are the 4 action areas that we intend to deploy immediately. I can assure you that as we learn more about the cases involved, we may well come up with other recommendations that we feel will more particularly affect the outcome of the investigations in the case of both Desiree and Peyton. Bottom line, this is tough work. We have very dedicated, hard-working employees at DCF who are doing the toughest job that we can ask anyone in state government to do, which is to try to protect vulnerable children who are in abusive and difficult, very, very disturbing family situations. As you know, they make tough calls. Mistakes will be made. But I do think that we have to ask the question, what can we do as a state to try and increase the odds of success? And obviously, the death of Desiree and the death of Peyton should remind us that we've got more work to do. Be happy to answer questions if you have them.
Governor, last week I asked you if you thought DCF was focused too much on reuniting families, parents and children. And at that point, you declined to answer. So what changed between then and today? Last week you noted the ongoing investigations, both internal, criminal, and the Senate panel. So why do this now, even though those are still ongoing?
Well, I want to be very clear that, first of all, it's important to remember that the recommendations I'm making now are not a result of specific actions in the case of Desiree and Peyton's deaths. In terms of why I didn't make any recommendations last week, I asked my team, right after I heard about Peyton's death, to start thinking creatively about recommendations that we could take and make that would help us in this difficult struggle that we're in of protecting Vermont's most vulnerable kids under a barrage of difficult addiction and other challenges that are more difficult than they were. So I didn't want to start going out with individual pieces last week until we had a package that I thought was thoughtful and ready for prime time, and this is that chance.
So this is going to be paid for...
Sorry, I want you were follow-up now.
Yeah, just quickly, so do you believe that DCF and the agency are too focused on reuniting families and not giving it due diligence at this point?
No. I believe that it's too early to pass judgment based on these 2 cases on the reunification question. What I do believe is that these are really difficult, tough circumstances. And when you have a kid that's been abused and has been removed from the family, and then you're contemplating putting them back with the mother or dad or both, it makes good common sense to have a supervisor review that case when it is the most difficult, troubling cases that we face. And that's a change that I just think is prudent, with or without the circumstances that we're facing.
This is going to be paid for by using funds that were the anticipated caseload savings from Reach Up. Were those going to be used to reduce the benefits cliff in Reach Up?
So let me be clear. This is going to be paid for, although that may be a part of it, from existing budget money that's already been budgeted to the department. They've got a huge agency, as you know. What this pilot gives them the authority to do, and we've given it to a number of agencies in state government, is give them what they've always asked for, the commissioners and secretaries, much like the CEO of a company. Manage to the dollar, but give them the latitude to decide where they need to spend their resources. So it will come from the current department's budget. It's about $1.6 million.
Will this impact the plan to reduce the benefits cliff for families on Reach Up?
No.
What do you think it will come from? I mean, what will they not be able to do instead?
Well, it's not a question of what you won't be able to do. It's a question of how you have the flexibility as a manager, as the CEO of an agency, to spend your dollars where you think you need them the most. And that's something that we've been asking for from the legislature for years. We're thrilled to get it, and we think this is a great example of why we need it so badly.
Do you think if the 4-point plan had been put in place a year ago, it would have made any difference in these two cases?
Again, I'm not going to speculate on these two cases in any way. We've got a criminal investigation going on. As you know, I've asked for a individual investigation, which Dr. Hagan, a independent investigation, which Dr. Hagan is undertaking, BCAB. And I want to make very clear that I'm not making these recommendations based upon individual circumstances in these two cases. There's a criminal investigation going on, and I very much want to bring whoever killed Desiree and Peyton to justice, and I don't want to affect those investigations in any way. So what I'm saying is big picture. As a governor who knows that we've got more challenges than we thought we would ever have on DCF from dysfunctional families who are affected by, whose challenges are compounded by addiction, and who do things to their kids that frankly most of us would never have contemplated were it not for substance abuse. How do we use our resources more wisely to heighten the likelihood that we succeed in these very, very difficult cases?
How are you drawing the connections so strongly between addiction and child abuse? Where is that evidence coming from?
You know, the more I learn about opiate addiction and the rising challenges that we're facing with opiate addiction, if you talk to any addict, they'll tell you that opiates have a couple effects on you. One is that you'll turn into the best liar and the best denier that you've ever met just to continue to abuse. And the second is that you will do things to the people that you love that you never would have contemplated were it not for the chemical changes to the brain that opiates produce.
But you said the complaints of child abuse have doubled in the last 5 years, but your health commissioner came out with a report recently that overdoses on heroin haven't substantially increased in the last 5 years. So I'm just wondering how you draw that connection so strongly, and if that's just anecdotal evidence, or if there's some statistical evidence that addiction is contributing to child abuse and the increase
and your definition of an overdose means death?
I'd have to look back at the report. I didn't.
Well, you should talk to the commissioner about that. But all I can tell you is that, you know, as we do things wisely, like deploy Narcan to everyone that will administer it, you know, we've saved 17 lives, or I can't remember what, 17 or 23 lives alone in Chittenden County over the last few months. You can talk to the state's attorney up there, you can talk to the health commissioner, but you'll have to take that inquiry to them.
I was more asking
if
about
you're
the connection to child abuse, opiate addiction's connection to child abuse.
If anyone denies that opiate abuse and use is not connected to child abuse, anyone who claims that it's not connected to child abuse, I believe should dig more deeply. There's no question. There's a correlation between what's happening to our children and the fact that people who are addicted do terrible things to the people that they love.
The potential reorganization of DCF, is that something you can do unilaterally, or would you need a bill?
No, I can do that by executive order as soon as, or actually just do it, and as soon, not executive order, right, or don't need executive order. And as soon as Secretary Racine gets me that report on August 1st, I'll make a judgment.
And the review at the supervisor level at DCF, the worker who was actually in that Winooski home, I believe, was himself a supervisor, but in the branch office. Or are you talking about supervisors not at the various satellite offices, but so someone higher than him?
Right, so I'm talking about not the person who is actually doing the casework, going in and visiting the family, making the judgment to recommend that reunification take place, but a supervisor above that social worker.
The changes you're describing, do you know how much it would reduce the caseload number or ratio towards that 12-to-1 goal?
You know, I won't speculate on that, and nor would I recommend that anyone do. I mean, if you told me that our caseload was going to double, that the number of investigations being requested was going to double 8 years ago, I would have thought that implausible. we have to understand that there is a connection between addiction and the rising tide of addiction in Vermont and the other 49 states and this challenge that we're facing right now. So as long as addiction continues to rise, you can bet that caseloads will continue to rise.
One thing that I found curious about this issue, and it's my understanding that while the caseload, the numbers are up, the numbers of kids in state custody has remained pretty consistent at right around 1,000, and that number hasn't really changed very much. Why is that?
Maybe I should turn it over to the commissioner for that.
Sure.
He's probably been waiting for me to...
No, I have no While the number of children in custody is fairly constant, right around 1,000, the total number of children that we're very actively involved with is closer to 1,500. Several years ago, we put more of an emphasis on what we call an open case. These are children who've been assessed as being at high or very high risk of maltreatment, but they do not warrant, the situation is such that it does not warrant taking the children from their families and moving them into custody. Parents should never have to lose a child to the custody of the state in order to get help for their child. For too long, that was the only pathway for many of the supports that we provide. So while that number, the caseload, has been relatively constant, around 1,000, it moves a little bit, the total net is larger at approximately 1,500.
Has that number changed, the total net?
Significantly. Well, yes, it has. The number does move, but the number of children and families on this open cases, just several years ago, we had 80 families. Today, that number is around 450 families with some 1,200 children, 200 of which are under the age of 2.
Wait, can you go with